Welcome to our brand new series, Anatomy Dissected by Complete Anatomy. We'll start this series by looking at the cranial nerves. So let's start with Cranial Nerve One, the olfactory nerve. In this video, we'll first explore the function of the olfactory nerve, examine the tissues it innervates and its pathway to the brain. We'll finish off by looking at some of the important clinical points. Cranial Nerve One is responsible for perceiving odours that enter the nasal cavity. Along the superior surface of the nasal cavity is the olfactory epithelium, a specialised tissue for perceiving smell. The olfactory bulb sits on top of the nasal cavity and has projections to the nasal epithelium below, which pick up different scents and smells that enter via the nostrils, or indeed the mouth. In a process called retronasal olfaction, odorous molecules travel from the mouth via the nasopharynx to the nasal cavity, contributing to our sense of taste. The path that information takes from the nose to the brain is pretty straightforward, so it's a good cranial nerve to start with. The olfactory bulb sits on top of the cribriform plate of the ethmoid bone. Holes in the cribriform plate house downward projections from the bulb, carrying them to the nasal cavity. At the end of these projections are cilia, which are the small hair-like extensions at the terminal end of the olfactory sensory neuron. Odorous particles that are dissolved in the mucus layer stimulate the cilia, and a message is passed up via the dendrite and the cell body to the axon of the olfactory sensory neuron. The axon synapses with a mitral cell in the olfactory bulb above the bone. It's the mitral cell that carries information on individual odours back to the brain. The olfactory bulb is the most anterior part of Cranial Nerve One. Posteriorly, it thins to become the olfactory tract, which runs inferiorly along the base of the brain, specifically the frontal lobe. As it approaches the brainstem, the olfactory tract divides into olfactory stria. Cranial Nerve One is one of two cranial nerves that do not directly enter the brainstem. The other is the optic nerve. Instead, it communicates directly with the uncus, where information enters the olfactory cortex. The olfactory cortex has connections to many other areas, allowing it to decipher different smells, and it combines this information with other sensory inputs to execute a motor response. Like all other nerves in the human body, the olfactory nerve can become damaged. However, it's unique in its ability to regrow. Traumatic injury of the olfactory nerves can be caused by a coup contre coup injury, where the brain moves forward and backward within the neurocranium due to rapid deceleration. For example, falling and hitting your head on the floor. The olfactory tract is stretched and torn due to movement of the brain. However, by far the most common cause of damage to the olfactory system is a viral infection of the respiratory tract, the common cold or influenza. Regardless of the cause, symptoms of damage to the olfactory system are hyposmia, a reduced ability to smell, or anosmia, an inability to smell at all. Hopefully now you have a better understanding of Cranial Nerve One. At this point, you should be able to identify the olfactory nerve and discuss its course. You should be able to discuss the nerves that make up this pathway and the function of the olfactory system, as well as understand how injury might occur to this nerve. So that's it. If you're looking for more info on the cranial nerve, stay tuned for the rest of the series. For top-class anatomy content, like and subscribe to our channel.